back. It's been a very chaotic last like 2.5 weeks in our lives. And we're gonna just do a little recap. So, Bex, what happened?
Well, Steph sent me to ER and I had an emergency appendectomy. So,
Yep.
yeah, didn't think that was going to be in the cards for me. Like 8 months ago, 9 months ago, I like remember saying after my thighs that I was just like, I'm done. No more
Hmm.
surgeries for me. Like I just want to like recover and let all the inflammation go down and like find some homeostasis in my body. And now here we are
Yeah.
with yet another surgery under my belt. So
I'm
yeah,
just glad that I woke up like within an hour of you texting me
yeah,
because with the
me too.
time difference. And you were telling us like, what symptoms are you having? Da, 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 da. Like I'm
Hmm.
like Bex, you're saying it's getting worse from 3 p.m. I'm like, Bex, I know you don't want to go. I know you don't want to wake up your husband because he has
Hmm.
work. Bex, get the fuck to the ER. And
Yeah.
then what happened? Oh yes, she had, so they called it acute chronic appendicitis.
Yeah, so
So,
I had chronic appendicitis last, who knows, decade plus,
mhm,
and then it turned acute and it needed to get
yes,
out.
because what happens is you can have what is called an appendicolith, and it can be made out of fecal matter too,
Lithium.
and it gets stuck in there, and then it
And it
gets
rattles around.
irritated. Yeah, and then her bowel was not happy either, and they thought they might have to resect part of her bowel, and I'm so glad they did not have to do
They did
that.
not, thank God. No.
Hmm.
On the CT, it didn't look great, but luckily in person, when he got in there, he said it looked fine. So
Hmm.
grateful for that. And what happened with you, Steph?
Um, I went to Duke and I had my endoscopy under general anesthesia, and he dilated my lower esophageal sphincter to 21 millimeters, which is the biggest thing, um, to kind of try and reverse my Stretta procedure, which caused worsening dysphagia or esophageal motility. My esophagus wasn't working 90% of the time, when prior to the Stretta, it was working 80%, not working 80% of the time. So the Stretta made it worse. And so we are trialing getting off of Flexerol this coming week. Um, and seeing how that goes. If I'm still having some issues, he said he might want to do it weekly, 1 to 2 more times. So that's what's going on with me. And Willow, what happened to you this week?
Anything exciting?
I had some medical stuff as well. I
Yeah.
was been in a lot of back pain for the past couple weeks. And I went to the doctors on Monday and they found out I had a UTI. Then my back pain didn't get any better. Then my doctor thinks I've been going through kidney stones. And
Ouch, yeah.
so, yeah, it's the first time I've ever had kidney stones. So it's been interesting. I'm doing a lot better now. But of course, on top of all of that, I was on my period. So
Oh, yeah, that
it always comes
sucks.
in threes for me. So, but today's been a better day than the
Good.
past few days. So I'm happy about
I'm,
that.
I'm glad it's
Good.
better. I feel like everything comes in waves for me and Bex too. It's just raining, it's pouring,
It's
it's just
boring.
still pouring.
Yeah. It still
Yeah.
is,
Yeah.
yeah, especially for my family. I've had multiple people pass away. I've had
Yeah.
a couple illnesses, broken bones, and then a family member who is now needing a liver transplant. So it's just like, and that's all within the last, and oh, and then my stepdad went to the ER, and that's all within the last 3 weeks. So it's just like,
Yeah.
could
It's
it
definitely
stop?
been
Is
crazy. Yeah.
2025, can it be done now?
Yeah, right. I
Jeez,
mean, I feel
So
like
close.
2025 is almost over, and I'm like, what happened? I
I
don't
don't even know.
know.
I don't even know.
Uh,
Well, Willow, why
yeah.
don't you introduce yourself to our listeners and kind of give a little recap of like who you are and what you do?
Okay. Yeah. So my name is Willow Lanier. And I started a health journey back in 2018 I got very sick, and for a year and a half, people didn't know what was going on until I had an aunt who's a functional nutritionist in Austin was like, come out here. I'm working under this amazing doctor. Let's try to run some tests that are outside of the Western medicine. And they found out that I had mold toxicity poisoning and heavy metal poisoning. I did treatment for that for about a year and a half in Austin, and I wasn't getting any better. And so I then was diagnosed with Lyme disease and Bartonella, which is also cat scratch fever. And so ever since then, I've been on a crazy health journey. As work goes, I'm an entrepreneur by heart, but my family owns a salon and gift store in downtown Asheville called Willow's Dream, and that's how I met Stephanie. She's one of our amazing stylists. And I also have my own business that I started this past year called Guided Dreamer. And Guided Dreamer is basically a place where people can go to find tools and techniques and stuff like that to help them become their better version of themselves. If it's through aromatherapy or just needing someone to talk. And I'm starting to make meditation candles with another friend of mine. And so my goal is just to help as many people as possible and help guide them if they want the guidance. And because Lyme disease is something that a lot of people have, but a lot of doctors don't know what to do. And I just want to help guide in any which way I can so people don't have to suffer as long as I have, which has almost been 9 years. So I'm lucky now that I'm doing a lot better. I found an amazing doctor in Mexico through people in Texas, and I have a doctor here that's absolutely amazing as well. So yeah, that's a little bit about me.
Thank you for sharing that, Willow.
Of course.
We wanted to see, so Bex and I were talking about before you got hopped on, at any point in your journey when you were going to like Western medicine doctors, etc., when did you turn to the more holistic side of things?
Yeah, so to begin with, I went to school for occupational therapy assistant, and during that period, I was getting sick all the time. I had bronchitis, I had stomach problems, and doctors could not figure it out. I even had one doctor tell me I had depression of the gut. And when I figured out that the tests that I even went to Mayo, like the tests that the Western doctors did were not extensive enough to find the answers, and they didn't want to take the time to do so. And I don't know if it's because it wasn't in their scope of practice or if it was big pharma. But when it comes to Lyme disease and stuff like that, I read an article where to get a proper diagnosis through Western medicine, you have to get 3 separate blood tests in 1 week. And no doctor wants to spend that time and money, and insurance would not accept that. So I did have to look outside the box because I was not getting better at all. There was no other. I was getting the test of, oh, everything looks good, but there is something going on, kind of thing.
Yeah,
So.
I feel like a lot of people can relate to that. Is like you go into the doctor and you're there because something's wrong. And like with obviously this is different with us because we had bariatric surgery, but like even
We're
as like
also
a
chronic ill.
woman,
We're also
yeah,
chronic
like
ill,
we're
so.
also chronically ill, but like even as a woman, just going in to a doctor's office and it's a male, it's intimidating. And if they just like they talk over you, they don't listen to you, and they're like, oh, well, there's nothing wrong with you, or they blame it that you're obese. That's the problem, which we hate that so much.
Or mental. Mental was the
Oh,
biggest thing
yes.
that I
Yeah, it's
got.
anxiety, it's depression, Yeah. Or it's
It's
obesity,
all in your
and those
head.
are the options. Yep.
Yeah, and
Yeah.
especially with me, because at a young age I was diagnosed with general anxiety disorder and major depression. So they had something to fall back on.
Oh
And
yeah,
they
as
were
soon as they
like,
see that on your chart, they
yeah,
they immediately default to that. Like, oh, it's just anxiety. And you're like, no.
It's
exactly.
not. Yeah.
Yeah, it's not
It's un
cool.
it's unfortunate, and I wish doctors would take the time to sit there and listen and treat people as a whole person. This is the main reason why me and Bex do what we do,
Mhm.
and why Bariatric Warrior Support was created, to have that resource that everyone is in one space. You don't have to go here, 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 and there. And
To
there are
find support,
people
yeah.
who truly are compassionate and caring and treat the whole person, and not
Mhm.
just, oh, you're here because your stomach hurt. Well, then go home, and they have no. For example, when Bex had to call her on-call surgeon, and she's like, I'm in pain. I've done Tylenol. What else should I do? He's like, I have nothing for you. You went to
And then,
school to be a doctor,
mhm.
but
Yeah.
you
Yeah.
won't tell her anything, but yet you're gonna call her this thing that she's about to say right now.
Yeah, he called me. He basically said I was drug seeking. Um, and I was literally 24 hours post-op. And I was like, no, no, sir, I'm not drug seeking. I'm actually in physical pain because I had surgery 24 hours ago.
Yeah.
Good news. 11 days later, still in fucking pain. Same fucking pain that was there day one. And I was offered Oxy 9 days later.
Wow.
And I
But
was like,
when you
too little
and
too late, dude. I'm not doing it.
she doesn't like being on it because it
No,
messes with everything, and like it's like
no.
I needed it when I needed it. I don't want
Mhm.
it 9 days later when I
No, I needed
don't
it
need
the
it.
first 2 days post-op. And I had, to be fair, I did have a prescription for Oxy, but
But it was like for 1 day.
it was like I had enough for 2 full days, but spaced out 6 hours.
Yeah.
And it was the lowest dose, 5 milligrams, and I was having
I'm
breakthrough pain
sorry.
at hour 4, and I kept telling him, I'm having breakthrough pain. Can I
Yeah.
take it earlier? And it wasn't until the very end that he was like, well, I guess you could take it earlier, but then you're going to run out faster. And I was like, or you could prescribe me, like a handful more just for a couple
Hmm.
hours more. And he was like, no, there are people who get this surgery without any pain medication. And I was like,
Hmm.
that's good for them.
Yeah.
I'm
But
not gonna repeat what I
Thank you
wanted
for
to say to
generalizing
him.
everything.
yeah,
Like,
it was wild. And yeah, I mean, that's like not even just,
I'm sorry.
that's just like scratching the surface. It's like
Oh
one of
yeah.
the most recent interactions with
Hmm.
Western medicine where they just kind of like brush you off. And I was like,
Yep.
you can look at my chart, man. I've never asked for pain meds. Like,
Yep.
I didn't even want you guys to
Hmm.
technically give me any before I had surgery, but I was in pain.
For
So I was
Hmm.
sure.
like, I
Hmm.
should probably take this.
Hmm.
And like, you're talking about like, you said functional medicine. Is it your aunt is a functional medicine doctor? Is that it?
She's a functional nutritionist.
Nutritionist.
So
Okay.
she worked under a functional medicine.
Medicine doctor.
I'm
Okay.
gonna, her name's Kathy Katz, and she literally saved my life and started this health journey with me and was there when I was living in Austin every single step of the way. And I liked it because her daughter also went through a huge health journey and went through the gamut for almost more than 7 years trying to figure out what was going on. And because of that, she got the passion as well to help
Hmm.
people. And that's why she went into it.
Hmm.
And without her, like, I don't know where I would be today, because at that time, Asheville did not have the doctors, the functional medicine, the holistic people to go in that route like they do now.
Hmm.
Yeah.
Yep.
And like I said, like Western medicine, because my tests were coming back normal, and the Lyme disease is so hard to detect, and unless I have
Hmm.
acute case of it, and that's like in a short period of time, I could have acute case in 1 hour and the next hour be completely fine.
Hmm.
Yeah.
And that's not how it works. Like in Western
No.
medicine, you have to be
Hmm.
sick the whole entire time to get
Hmm.
it. And it is interesting because I do believe this whole thing is the doctors do have limited say and do
Yeah.
because of insurance and big pharma. And because of that, their minds start to get smaller because that's all they know.
Mm-hmm.
Mm-hmm.
Unless they
Yeah.
really decide they're like, I want to make a change and get out of it. But that takes a lot of work to do.
Mm-hmm.
And
Yeah.
some people just get stuck in the routine and then that hamster wheel
Yeah.
of doing that.
Yeah, and they get burnt
So,
out too. I mean,
Yeah.
so many doctors we see that like probably went into it with the best of intentions.
Mm-hmm.
A couple years down the line, they're so overworked and they get like literally 15 minutes per patient and that's it. And
Yeah.
then we as the
right.
patients are upset because we get 15 minutes and like
Or
that's
you
it.
waited 3 hours, your appointment was 3 hours ago, and then you get 15 minutes.
And then you get 15 minutes, or you waited,
Exactly.
6 months or a year and you get
Yeah.
15 minutes. So
Or
yeah, it's
or you waited 6 months and then they cancel your appointment.
that too. Yeah. And push
Yeah.
it out even farther and all the
Mm-hmm.
things. Yeah. So it's just like,
Yeah.
yeah, I do try,
Mm-hmm.
to do my best to give doctors some level of grace because both of my parents are physicians. So like I do
Right.
understand that world, but I also am just like, do better, guys. Do better. Like
Mm-hmm.
I get it. Y'all are so overworked and understaffed, but like you are leaving things on the table and people are suffering and dying
Mm-hmm.
because you're
Or
not.
you could be Or you could be Steph, who's running on nothing, barely functioning, and still going above and beyond, and doesn't know how she's not falling over. Because, again, the whole thing of not letting someone suffer in silence. And when you have gone through it yourself and you have had to advocate so hard for yourself, you're like, I'm a nurse. I know what you're talking about. I know what's going on. You're like, no, this is what you need to do. And then they still don't listen to you. And it's frustrating. And if
But I
I
do
was
think
not,
that's the difference.
mm,
I think because
mm,
you're going through something,
mhm,
you
Yeah.
have the understanding where most nurses and doctors haven't gone through
mhm,
something that drastic. And so
mhm,
having that understanding is hard for someone to grasp if they haven't gone
Haven't
through
been
that
there.
themselves.
yeah,
Yeah.
And I do believe the people that have gone above and beyond have gone
mhm,
through something similar or something
Hmm.
tragic in one way. If it's
mhm,
seeing a family member or a best friend or going
mhm,
through something like that to give them the boost of fire to
yeah,
go and
Yeah.
move forward. And I
yeah,
think that is truly what moves people in general, if it's in health or anything in life, is that
mhm,
there has to be a purpose behind it and a reason to provide
mhm,
that lesson to help people
mhm.
understand.
Yeah. Yeah.
But I wish it
100%.
didn't have to involve something
True.
like that for people to
Get
care.
adequate care. Yeah.
Yeah.
Yeah. Absolutely. Yeah.
Mhm.
We wish it wasn't like that, but
Yeah.
you're right. That
For
is,
sure.
Mhm. But
and
yeah.
that is how it is in life in general too. Cause yeah, if you don't
Mhm.
have like, we all obviously sometimes don't wish that horrible things happened, right, to us, but
Mhm.
those horrible things are often the thing that produces change within ourselves. So,
Mhm. I
Right.
became bariatric warrior.
There you go.
yeah, because of all the
Yep.
complications and all the
I'm
shit we
like
went through.
I clearly had to go through all of this shit so I could just be there and do what I'm doing now with Bex and all of you to provide that support and that quality care and that compassion
Hmm.
and to have, because again, through it, the vital thing was to have someone in your corner, to
Hmm.
have someone who gets it and who's gone through it and knows that both the healthcare system and just personally, because there's so many people out there that don't have access to people to help them take care of them, or they have to jump through so many hoops with social workers, and then social workers, they're not specialized. So it's nice to have someone who has gone through something similar
For
to
sure.
be there to advocate for you or help you advocate. Hmm.
Hmm.
For sure. I
Yeah.
agree. I feel like
So,
that's why I do something similar.
yeah.
Hmm.
So I was gonna say, so how did um like more holistic treatment help you in your journey with Lyme disease, with your recovery? Like how did that play in, and then what led you to want to do that to help others as well?
Yeah, for sure. So one of the symptoms I got from, if it's Lyme disease or all the other co-infections, it's called mast cell. And
Yeah.
mast cell is basically if you have a lot of histamines in your body and there's an enzyme that helps you get rid of it and you don't produce enough of that enzyme. So I have that. And so a
Both me
lot of
and Sex
medication,
have that
All
too.
of us have it, all three.
yeah.
Yep.
So one of those big things is that I couldn't take certain medications because I was allergic to a component of it. And holistic medicine starts from the root. Everything starts from plants. And so by breaking things down, my body could take it and absorb it better than if I had a tincture of something or a medication full of a bunch of different things. And so holistic medicine provided that for me. But I also do have to say holistic medicine was the one that caught my diagnosis. Western medicine didn't.
Yeah.
And so so having that and knowing the root cause and know that plants can help and you don't have to add all these different components all the time. Don't get me wrong, like I still was on antibiotics and I still was on Western medicine treatments because there's things that need it, but it wasn't the core of my treatment. And so I could break it down to the simplest things. So
it was a piece of the whole picture that was supporting you.
Exactly.
There was
And
Western medicine, but there was also holistic as well.
Exactly. Because I do believe not just one. It's kind of like a yin yang, right? You have to have both sides to create the circle, the masculine and the feminine. And that is kind of like Western and holistic medicine is that. It is you need to have both to continue forward.
Yeah.
Because there's good and bad with both. So
they support each other for sure. Yeah.
Exactly.
Yeah. And where one has limits, the other may not, and vice versa. It works for different things. Yeah.
Right.
Yeah. Yeah.
So, yeah.
Yeah, like you can't kill an infection without the antibiotics, but there are certain things that might help your body better fight along with
Echinacea.
Yeah.
Echinacea, elderberry.
zinc or whatever else. Yeah,
Zinc.
exactly.
Vitamin C.
Right. And then like for me, like pain wise, like arnica was one of the biggest things that helped me get through a lot of it because taking pain pills for me, I'm going to be in bed constantly and I still have to live my life. So going to the simplest plant like arnica really helped me function in my everyday life, but also help with the pain as well.
So we also have used arnica for our skin removal surgery because it has properties of helping with bruising and inflammation and swelling and pain like that. And so we've used it in the sense of like a gel, a oil,
And
as well
oral.
as taking like oral tablets of arnica as well, or tea.
Right.
Yeah.
I will say that for me personally, I did not notice any pain relief from any of that. But, you know, like everybody's different, right? So what may work for you is not going to work for me and won't work for staff. You know, we're all going to have, because we're all human beings and we have to be treated as a whole thing. And we can't just be like blanket statement, you know, arnica's great for everybody. No, not necessarily. So,
no. And it's all different dosages too. Like someone can be doing the minimum dose and feel fine, or someone has to do the maximum dose to get it. And then it's also the forms. It's like some people like to do the syrup and some people like to do the little tablets, like and all different. There's so many different ways to receive it as well that your body can absorb it better.
And like, obviously. Also, we have to put this out there. We're not doctors.
Oh, yes.
Always talk to your doctor before you try anything. Yes.
interaction, something could interact.
Because of, yes. Make sure that it's okay with your provider. Yeah, because like because of how my GI tract is set up, So my GI tract is different than both of yours. Because obviously you didn't have bariatric surgery, Willow, but Bex had a sleeve, and then I had a
Right.
sleeve to a gastric bypass, and then other crap in my stomach is like non-existent. So my absorption and having small intestinal bacteria overgrowth, which also affects the absorption of fat soluble vitamins, um, basically is so much different than a lot of people, and that's why it needs to be individualized. So
Right.
that's why I love tinctures because I absorb that type of way
Better.
better. Then obviously, if I was to just eat something, I would be absorbing maybe 5 to 10% of what I'm actually putting in my mouth. Or like a tablet that's just gonna
Sit
go
there or
right
just go
through,
straight
sit or
through.
just
Yeah.
go straight through and like not have any effect.
Yeah.
So, and I think that also comes down to we could talk about surgery and if you ever go under anesthesia and you are bored a redhead or you have to be on pain medicine and you're bored a redhead because we need a whole lot more of it to
Yeah.
actually you know go to sleep and be pain free. Yeah.
Yeah.
Hmm.
Yeah. We
Right.
all are gonna, depending on our illnesses, genetics, all the things. Yeah, we're gonna absorb differently. Because EDS, we're gonna absorb differently than somebody else as well. You know. So,
Yeah.
and then
Right.
yeah, MCAS is gonna impact surgery, recovery, everything. So POTS,
Yeah.
all those things affect it.
And they all like to run together. If you have one, you
Yes.
probably have four.
Yeah. Yeah. If
Yeah.
you have one of them,
Uh-huh.
you probably have the others.
Yeah, you probably have the others. Yeah.
Mhm.
'Cause like and I found that all of mine, like Bex, did you find that all of yours just like started like happening right after having a surgery?
So that's one of my
Hmm.
things that I am learning is that you can have all of these things previous to having major surgery
Hmm.
or a major life trauma. They can
Yep.
all be there,
Hmm.
but they could be very mild
Hmm.
or you
Exactly.
might not even notice. And that was me. I had subluxing shoulders my whole childhood, and that was my quote unquote party trick, was like being able to sublux my shoulders in and out.
Hmm.
But I did not that's it. That is the only symptom that I had. And I did
Hmm.
have the MCAS flushing, the histamine flushing, but I
Hmm.
had no other symptoms. I had no pot symptoms that I knew of. I had no other MCAS symptoms. I had no other EDS symptom, nothing. And then I had weight loss surgery. And I thought something we don't talk about enough is the impact and how traumatic weight loss, massive weight loss, is on your body. And that it can, switch the genetic flip, or flip the genetic switch. There we go. There. Speaking is hard.
Hmm.
And it can turn on autoimmune diseases that have always been there, but were mild, or you didn't have any
They
symptoms.
were dormant.
Yeah, dormant, exactly. And then it
Hmm.
can trigger them to happen. And the same is true of any surgery. It doesn't have to be massive weight loss, any surgery, any illness, any major trauma in your life can flip that switch and turn on a disease or an illness that you didn't previously know you had.
Yeah. And for me, that was the mold was the flip of the switch for me.
Hmm.
The
Yeah.
mold, so my Lyme disease did not come from a tick. It came from my cat biting me. And my cat bit me 2 years prior to me actually getting sick.
Okay.
And so the flip of the switch was the mold toxicity, which kept everything that was dormant and made everything active.
Hmm.
And yeah, so it is true. And it also, I have, it's called PNES, which is no, it's, what is it called? Psychogenic non-epilepsy seizures. So I have seizure-like tendencies, but it's
Hmm.
not a real seizure. And a lot of people get this just trauma in their life. And so,
Yeah.
like you were saying, Bex, it's, yeah, anything can cause anything. And it's
Hmm.
how your body holds it all and how it releases is
Yeah.
truly what it is. So,
Yeah.
And we
Yeah.
know we all have medical PTSD.
Yes.
Yeah.
Yep.
I will say
That's
that like functional medicine though, like they're still doctors or they still
Yep.
can be, or they can be, NPs or whatever. But I have a functional medicine NP right now and I've had her for the last 2.5 years. Prior to that, I did not. I had regular doctors, everything. I have been to an endocrinologist, I don't know, probably like 3 or 4 times and said, I think you should check my thyroid. I have all the symptoms. And they went, no, your thyroid's fine. And like they straight up refused to check my thyroid. And then I went to a functional NP and she said, huh, we should check your thyroid. Guess what? I have hypothyroid. Like I'm hypothyroid.
Yep.
So I am on thyroid meds and guess what? All those symptoms gone because I'm on the right meds. Like, and it took a functional medicine doctor to listen and
Yep.
actually be willing to do the tests. And you know what?
Yep.
Those tests, like specifically like thyroid, like they're really not that out of the ordinary. They're not
No,
that.
they're like they
They're
test those
normal
with
tests.
your physical yearly.
Yeah,
Like
yeah.
I'm
And they're normal tests and they're normal tests that endocrinologists do. But for some reason, these endocrinologists, every time I said, these are the symptoms I'm having, they would just tell me that I was fat and needed to lose weight. And I'm like, maybe you should check that part of the reason I'm fat and struggling to lose weight
is because you're
might be my thyroid,
hypothyroid.
But yeah.
Yeah.
And
It's
we,
like
we years of misdiagnoses before any of us ever get like a real diagnosis. So
it's like they think that we are going to the doctor
for funsies, just
for
for shits and
fun
giggles. Yeah.
for no reason, and so that's
We're
why
bored
they're
today.
just like don't want anything to do with us. And I'm like, you're in the wrong field if you want nothing to do
Right.
with people. I'm like, oh. It has been a
Yeah.
wild 4
I've
years.
definitely have had that.
Yeah. Yeah. I feel like
Yeah.
that's a fairly like for anybody who's chronically ill, it's a really universal experience, unfortunately.
Can we talk about something that I want to talk about because I've talked about it with you, Bex, before is like, when did you say out loud or recognize and acknowledge that you were chronically ill? And before that, what held
Interesting.
you back? What held you back?
Do you want me to say what I think, what I know for me?
I don't.
Yeah, all of
Oh,
you.
you
I
can
want
go.
to hear all of
No,
it.
Right.
see, I want to hear Willow's
Oh.
answer. So go for it, Willow.
I still haven't said it.
Okay.
It's really interesting to me because I do believe, like, if I say it, my mindset goes like this. If I say something, I am that. And so I try not to say things so I don't become it.
We
And
did have that
because I
conversation,
haven't,
Willow.
Yeah.
yes, yes. So for me, I acknowledge the fact that I do have chronic illness tendencies. And to be fair, you could label me as that. But if I looked in the mirror and be like, you have a chronic illness, it would take over my whole life. I
Yeah.
would not be able to get away from it. But I also do recognize in therapy, especially, there's certain things that my brain has done due to the illnesses at hand. If it's the way of my brain was thinking at the time or the way my body was reacting was due to it. But I wouldn't technically want to say that I am chronically ill because that doesn't mean I always will be. Right now I'm doing a lot better. Yes, I've had kidney stones and I'm doing all these things, but my underlining for my Lyme disease of feeling constantly sick is not there right
Yeah.
now. And so if I would say I was chronically ill still, I would guarantee those feelings might come back. And so I try to keep myself away from it, but I also acknowledge that it is probably good to say it in a certain setting to help other people.
Yeah.
It's just also, who are you talking to? Are you talking to the person? If I talk to you about something I'm going through, are you going to say you have it too, even though you don't have it? Like, I've talked to multiple people similar to that.
Oh yeah.
And so it's like you
Mm-hmm.
have to be careful on how you word your things and what you
Yeah.
say, so people don't take on your words and that energy and the
Mm-hmm.
illnesses that you provide. And so for
Mm-hmm.
me personally, I say it in the sense of, if someone needs the guidance and needs help on a journey, I'm like, this is what I've been through.
Mm-hmm.
These are my experiences. This is what has
Mm-hmm.
helped me. This may not help you, like Bex has said.
Mm-hmm.
Mm-hmm.
However, take it or leave it. Like, it's
Yeah.
what you want to make as your own journey, and
Yeah.
everyone has their own path.
Yeah.
Yeah.
I think that I feel two different ways about what you were saying, Willow, which is so interesting to me. Because on the one hand, I feel like, why would you not acknowledge that you're chronically ill if it would
Mm-hmm.
help you? If it would help you find compassionate care, if it would help you find community, if it would help you give yourself more compassion and care. Because, like, I don't know about you, but like Steph and I do this a lot. We push through no matter what. And that to our detriment. Sometimes like we end up way more ill because we pushed through and pretended we didn't have a chronic illness
Yeah.
instead of being able to acknowledge it. On the other hand, I 100% believe that what you think of and the way that you think of yourself and what you manifest
Mm-hmm.
impacts not only your mental health, your physical health, and it also impacts just like how you show up in the world.
Yeah.
I'm not religious in any way, shape, or form, but I am very spiritual, and I do a lot of manifesting as well. And I also know that, like, for a long, long time, I was very much stuck in like a really awful negative headspace where I was the victim and everything sucked and the world sucked. And guess what? It actually sucked. Like, it physically sucked,
Mm-hmm.
physically, mentally, emotionally, everything sucked. And as soon as I like moved my mindset and I started practicing being grateful and finding like the glimmers in the world and the happinesses and choosing to think positively,
Mm-hmm.
my life actually got better.
Yeah.
Like, not just like physically and mentally and emotionally, but like my life around me, everything actually
Yeah.
got better. So I'm on like the fence of like both sides of things. Like
Yeah.
there is an advantage
Yeah,
to
because I think,
acknowledging it, but also not acknowledging it at the same time.
and I think I'm kind of there. Like, I acknowledge of the things I'm going through,
Mm-hmm.
but acknowledging the fact of, like, because chronic illness for me is, of course, you're in a constant state of something is happening. If
Mm-hmm.
it's not what you're diagnosed with, it might be what you're going to be diagnosed in the future with. And if I keep my mindset that I wake up today and I'm still chronically ill, something might happen. But I
Mm-hmm.
do face the fact, if I wake up and I'm not feeling great, then I accept it and I move my way through that day.
Mm-hmm.
Yeah.
So I guess in the sense of, I'm similar to you in the sense, or what you were saying, is that I may not accept, I accept the facts of what life has brought me and what I'm
Mm-hmm.
going
Mm-hmm.
through,
And your
but putting a
limitations
label
or
on
whatever.
it
Yeah.
can
Yeah.
be pretty hard.
Yeah.
Yeah. And I
And it's
think,
interesting because you
Sorry if
got
I
both
keep
sides.
breaking out. I think my internet's
totally fine.
so bad.
Oh, you're
It's
okay.
okay.
As long
I
as we can
think
hear you, we're
I
okay.
think I
Okay.
think I also agree with like both sides of it is, I can see how saying it out loud can be detrimental because obviously mental health type of things, it can definitely bring your mental health down. But also, let's talk about another word that is commonly thrown around, stigma, and the stigma around what it
Chronically
is
ill.
to be chronically ill and invisible diseases.
Yeah.
And so, yes, even though we may not look like there's anything going wrong with us, there is.
Mm-hmm.
And but people don't know that unless we talk about it. And I think that's why I like openly talk about it
Same.
because
Yeah.
sure, I like can push through and I don't even know
Pretend.
how I do all the things I do, or what we call masking.
We fake it till we
Um,
make it. That's what we do.
yeah,
For
Or
sure.
until
but
we don't make it anymore.
but at the end of the day, like I always say, like I can't film my life 24/7. There is a bunch of shit people do not see.
Yeah.
There's a bunch of times where I'm on the damn bathroom floor crying, like. But it took me until I think it was November 2023 to finally say it out loud and accept it
That was after I
because
came up to visit you and you've been in the hospital.
uh-huh, yeah, it was like my surgery. I had like a GI bleed, and I had my port placed, and I was like, "Oh, well, here we are. We got the fucking port now." Like, we're chronically ill, but it was like I kept just trying to like be so positive and just go talk about it right away, and I never allowed myself to sit and process what I was going through. And I sat and processed it then, and I said, "Yes, this is going to always be a part of my life. It will wax and wane. Some things will go away and some
Mhm.
things won't, and then new things may come." Um, but I never, I guess I don't put myself in the, I'm trying to find the word. um, yes, I'm chronically ill, but like I'm a functional chronically ill person, if that's what I'm trying to say.
Makes it sound like
Even
you're a
though
functioning alcoholic. Like, I
I'm a
can do this.
functioning
Like,
chronically
I'm
ill
still
person,
functioning.
but also I'm not functioning when I have
Yeah.
ADHD paralysis because
Mm.
I don't function when that happens.
I
Um,
guess it's almost, it reminds me of
oh.
the conversation of like, is ADHD a disability? Like that's also a conversation that's going on in the community right now of
Mhm.
whether or not we can call it a disability or we should call it a
Mhm.
disability and what stigma comes with that word.
Yeah. Mhm.
Just like the stigma that comes
Mhm.
with being chronically ill or the
Mhm.
stigma of being obese.
Because I always get, well, why don't you go on disability? Because I've tried to apply for those things and I
They're not easy to
couldn't
get.
get it.
Yeah.
They're not easy to get unless you have a lawyer and years of your life you want to waste, and money that you can do that. But it doesn't give you a guarantee. And I also am in the place of like the one thing that I said that this was never going to take from me was my job and what I do and helping other people. And I rather that go to someone who really, really needs it.
Yeah.
And I don't want to take that away from someone else. And
Yeah.
so another reason of why I
Yeah.
created Bariatric Warrior Support and, to be that advocate and do what I'm really passionate about, but it also helps me not be on my feet and knees and bending over backwards, burnt out, in a hospital 5 to 7 days a week.
Hmm.
I'm actually doing something that I'm so passionate about and my heart is in, and I have done for the last several years without income from it because I'm just that person. I want to help everyone. And I don't want anyone to strain on finances or anything like that because I've been there. We've all been there in that
Mhm.
spot. Um, so yeah, it's all about like just the stigma around that because when you think chronically ill, I think a lot of people get this one vision in their mind of what that is, and that's not what it is.
There's so
And
many different
mm-hmm.
iterations of
And I think
Yeah.
you know,
that's why I
Mm-hmm.
don't say that, because
you don't want
I
people to get that idea of it.
I don't
Yeah.
want the people to get the
Mm-hmm.
idea,
Hmm.
but I don't want myself to get that idea
Yeah.
just because of the stigma behind it. But that's also why, like, I went to school to occupational therapy assistant. Like, occupational therapy kind of tells everyone is the same, but they just have to do everyday activities in a bit of a different way, because and it doesn't matter, like, if it's age, if it's ADHD, if it's
Mm-hmm.
autism, if it's anything, you still can live your day-to-day
Yeah.
life. There just needs to be maybe some tools and a little
Yeah.
bit of guidance on how to do it,
Yeah.
but it
Yeah.
doesn't
Adaptations.
hinder. Like, it's
Yeah.
not a hindrance. And that's why I think that the real discussion about labels, if it's a good idea to have labels in general, is a tough one, because for me personally, I do believe labels are good when it comes to getting the help a person needs.
Yeah.
But also, you got to be careful on the stigma behind it. And will that also hinder the person as well?
Yeah. That's always like everyone's like, oh, why did you feel like you needed to go and get diagnosed with ADHD as an adult? It's like, because now I can forgive myself. Because now I have a reason for all the things that I thought were
Right.
horrible about myself for so many years. And now that I have a label and a diagnosis and I know what it is and why, I can actually forgive myself and learn to like myself, which I spent so many years hating myself
Right.
for the
That's
things that are ADHD about myself, you know?
that's the exact conversation that me and
Yeah.
Willow had. She said, because when I got my hypermobile EDS diagnosis, she said, if having that diagnosis,
Helps you.
as a
Yeah.
label helps you, then she's like, I'm happy and I want you to accept that type of thing. But if it hinders in any way, like you don't have to like associate that you are Stephanie, you have hypermobile EDS type of thing. Yeah.
Yeah.
I'm like, because that got me thinking like, yes, I'm Stephanie, bariatric warrior who's had weight loss surgery complications and chronic illness, but that's not who I am. Like Bex
Exactly.
knows who I am. Will, you know kind of who I am. You're still getting to know me, but it's like we're so many other things.
Yeah.
And I think that in what we are, obviously their journeys or whatever, people don't see all of us in that way because we're just sharing about our journeys. So that's like something that I wanted to start doing, to be like,
Yeah.
hey, did
Highlighting
you
more.
know Bex writes books? Hey, did you know that me and Bex love karaoke? Like just random things like that type of thing. It's
Mm-hmm.
like,
Yeah.
because yes, Bex is not just becoming Bex. She did not just have weight loss surgery and plastic surgery.
Yeah.
There's
I
so
didn't just like
much.
pop up out of the
Uh-huh.
floor the day that I
There,
created that account
yeah,
and made
Right.
this my
there's
whole personality.
right. There's so much more
Yeah.
to the whole of a person. So
And
yes,
I feel
I
like
get
my
that.
parents taught me that. My parents, so I was born in Atlanta, and me and my brother and my parents moved to Asheville when I was 9, my brother was 7, because the Atlanta school system wanted to do a autism test. And my parents were like, we don't want our child to have that test, because knowing they knew for a fact it would place me in a box. I wouldn't get the help I truly needed to succeed. And so my parents moved to Asheville for that, because of that, and multiple other reasons, but that was one of the main ones. And because I didn't get that test and I didn't get that label, I started talking when I was 10. I barely could talk full sentences until then, and I was able to start looking people in the eye and having real conversations. I was able to do things that I know if I had that label, I wouldn't be able to do any of that today.
And see, I'm pushing back. I'm going to push back on that.
Go for it.
I'm sorry. I'm going to be that person because you also may have missed out on early interventions that could have helped you achieve those goals even sooner than 10 years old by not having the label. But I do 100% understand that there is so much stigma that comes with being autistic. But one of my other best friends is ADHD. She's got both, and she was diagnosed very, very young. And if you met her, you'd have no idea because she got all of that early intervention, social skills classes, speech therapy, everything very, very early. And it allowed her to be able to do all those things and achieve all those things. And she said that if she had not had that diagnosis, she would not be where she is. So I
I
just want to
still
point out
had
there's
all
two sides
those.
of that coin, right?
For sure, but I still had all those interventions because I
Okay.
had other diagnoses.
Okay.
So they were
Fair.
just didn't wanting to add on top of it.
And your parents were
where
already pushing for that help.
yes.
Okay,
So I
cool,
was
cool.
already in
Yeah,
speech therapy. I was already in interventions to
awesome.
help me because they saw I didn't meet the milestones when it came to learning
Right, okay.
in my learning disabilities. They just didn't want to add something on top of that
Especially with the
Yeah.
stigma. Yeah.
Yeah.
with the
Totally
stigma.
get it. Yeah. Yeah.
So I
I just
do
want to make
agree, like if they're, like I said before, like if the label's there to help you
help
and
you.
not
Yeah.
hinder
Exactly.
you.
Yep.
So for like your friend, having that label got her where she can get into those interventions.
Yeah.
For me, I already had so many other diagnoses to put me in those interventions
Got
that
it.
it would be just another diagnosis on top of it.
That makes sense. And see, I love that. Yeah. So it can be either, it can be both. It can be a
Yeah.
hindrance or it can be a
Exactly.
help. But
Yeah.
every
Exactly.
person you like, I mean, it's harder when you're a kid because you don't have a
For
choice.
sure.
Like it's your parents, right? Your parents make that choice to get you assessed or not. But, as an adult, you can, like you're doing, Willow, you can choose whether I'm going to take that label on or
Yep.
I'm not because it's not serving me in the way that I want it to serve me. So I like that.
I think
And
we
that
should
was
have a
like my big
shirt.
lesson.
We should have a
Go
shirt
for
with
it.
a piece of Velcro on it and be like, "Today I'm," and then just slap it on
Just put
there.
whatever it is on there. I'm ADHD today.
Today I'm ADHD. Like,
But tomorrow I won't. But I do like
tomorrow. Yeah, really funny. Yeah, and I feel like that conversation can go like back and forth so many times, and like every individual is different,
it.
and
I
I think
agree.
it's good to talk about like both sides
Yeah.
of it
Yeah.
because when you talk about it, you're
Reduces
helping
the stigma.
to reduce the stigma around it. Yeah.
Yeah.
So,
Yeah, and I agree. I think it depends on the journey of that person's life
Yep.
yeah.
and how it will help and what
Yeah.
is the background for sure. I do
Mhm.
believe that. And I think because my main thing mentally that I was struggling with were the labels. And my brother had to sit me down one day and be like, you have to watch how you're saying these things.
Mhm.
You're not the label at all.
Yeah. Mhm.
You're not Lyme disease. You're no
No.
mold toxicity. You're not heavy metals. You're not Bartonella. You're not Babesia. You're none of these things. You are Willow.
Yep.
And him and my parents, but mainly him, had to sit down with me and catch my every single word when I made it. That's who I was. And
Yeah.
so he really changed that for me a lot.
I think that's great. Yeah.
So we only have
That's
a few more
awesome.
moments here, but I want to ask, so how has like what type of holistic um interventions are you currently using in your business? And, like what is your goal? And just kind of give us a little quick rundown of that part of things.
For sure. Yeah. So Guided Dreamer came about because I'm also spiritual. And it's through my whole journey with the mental health part, aromatherapies like lavender, eucalyptus, citrus, and all sorts have really helped me get out of the deep, dark places of my brain. And because of all that, I was like, oh, this could help other people too. If it's in the shower, if you're driving and you get anxiety, if like talking on a podcast, like anything like that, I was like, oh, this it could be a good helping tool to help reset the brain and so people can move the way they need to move. So right now I just have aromatherapy, but one of my good friends, Amber, she and I are going to start making meditation candles. And the meditation candles will have a certain scent with a certain color with that purpose. So I'm really excited to go forward with that and to help people get in that mindful space and the mindfulness of continuing forward with any journey they're wanting to continue forward on, because especially with chronic illness in the mind, it is a vicious cycle. So
Yeah.
the mind can start a flare up of a chronic illness, or the chronic illness can lead down a path of mental health. And to help one side, you have to help both. So I do believe your olfactory senses, your smell is one of the main ways to help with that.
Yeah,
So
it's very grounding. I also
exactly.
have a whole bunch of aromatherapy stuff as well that I often use. So I definitely feel that.
Here it is. Here's my little fairy wand and this cute
Yes.
little spoon. So that's actually how me and Willow, I knew Willow had this amazing journey story. Is like I picked up these little spoons and I'm like, I'm gonna get some of those for my friends. And then I saw her story and I'm like, thank you for sharing that. And then we cried and hugged and now we're friends. But
Yes.
yes. But yeah, so thank you so much for being on the podcast, Willow. We
Thank you for
appreciate
having
you
me.
sharing openly and definitely we'll do it again. I know that
Yes.
we have so many ideas and things that we want to do coming up. And I shared with Bex, I said, so we're gonna go to this Harry Potter Airbnb in Asheville for a wellness retreat next year.
I love it.
It looks great.
I love
Uh-huh.
it.
Uh-huh.
I have
I'm
Yeah.
my
here for
issues with
it.
Harry Potter these days, but I do,
Oh
it
yeah.
was my whole
I
childhood.
mean,
So
yes. Yes.
yeah,
But yes, thank you so much, Willow.
Thank
thank
you.
you.
Make sure let our listeners know where to find you. What's your Instagram and everything?
Yes, so my Instagram is Guided Dreamer, and then I also have a personal, which is Willow Bean 88. I can't really remember on the top of my head, but it's somewhere that y'all can find it, and you can see my red curly hair. And that's how you'll know. But yeah, I'm on social media. You can always find me at Willow's Dream as well. It's in downtown Asheville, and my family owns it. So come stop by and say hi. And if you want to
Yeah.
talk about health journeys or if you need a little guidance, I'm happy to help.
Awesome.
Awesome.
Thank
Thank
you
you.
so much for taking the time out of your day and talking with us. And we look forward to what is going to be in the works for Willow's Dream and Guided Dreamer and Bariatric Warrior Support. Yes.
Yeah.
I'm
Uh,
excited. I appreciate y'all. Thank you.
yes.
Thank
We
you.
appreciate you. All right. I'm going to hit stop recording.